Welcome back to Homeopathy at Home with Melissa. Hey, Melissa.
Hey Bree, great to see you.
Always good to be here. Today we're talking about eczema, but
Hmm.
differently than we typically talk about things.
Right.
We just kind of on a whim decided that we wanted to have this conversation. We have a lot of questions, or we see a lot of discussion about it, where we have people come to us, and we just thought it would be fun, but also necessary to have just a candid conversation about
Yeah.
what we see and some remedies, but just why we encourage using homeopathy to treat it.
Yeah. And so what prompted this is a conversation that I had with someone who just couldn't well, she wanted to understand what is was the thing. The conversation was she wanted to understand, why was I saying that homeopathy was the only way? She was like,
Mm.
that can't homeopathy can't be the only way. And and because what do pediatricians and lactation consultants tell moms to do when their babies have eczema? And listen, you guys know I'm a lactation consultant. I spent
Mhm.
many years telling moms to cut dairy from their diets. And because I didn't know any better. And we're going to get into, there's nothing wrong with that. So lactation consultants and pediatricians out there, there's nothing wrong with saying cut dairy from your diet, but it's not the answer.
Yeah, I think that's a great way to put it, because sometimes, even as we use homeopathy, um, some of those things in tandem with homeopathy are great. I think what we're ultimately getting at is really they're not always necessary. A lot of the lengths that moms go to, I think also we need to clarify, we're specifically talking about babies and young children more than other. You can use homeopathy for eczema everywhere, but tonight we wanted to really maybe have some more focus on babies, or at least that's what prompted it, because moms will cut out so much food, go on these huge elimination diets, and we're still seeing babies that are unvaccinated, babies who have had really no Western medicine interventions, still having pretty severe eczema.
Mhm.
So that's kind of where we started going, and I'm sure we'll go off on rabbit trails for adults and all kinds of people. But
Yeah. Yeah.
um, yeah,
That's true. That's very, thank you for saying that, because yes, we are really talking about baby eczema tonight, but eczema is eczema. So whether we're talking
right.
about, adults or whatever, but like Bree said in the beginning, this is not your normal podcast episode where we talk about a condition and we tell you lots of remedies and differentiate. We are going to give you, a couple of remedies at the end, but this episode really is to help young moms understand that homeopathy needs to be, it's vital. It needs to be the core of your care plan. And that just eliminating foods is not the answer. So what we see in clinic is food elimination. So what I hear from parents who have older children who did have eczema as a baby, they outgrew it, is what they say, or they cut out dairy and while they were breastfeeding, and then the eczema went away. So yes, food elimination can be helpful. But what I see is that when you only eliminated food, or what, do you remember any of the other things, or do you know any of the other things, Bree, that pediatricians and
Yeah.
lactation say to do?
So if you go to a pediatrician, almost always they're going to prescribe a topical steroid almost
Yeah.
every single time. Um, and that's at least what I have heard, what I have seen for like people in my personal life dealing with this. It's almost always a topical steroid. To start there. If you go to a semi-natural one, or maybe an integrative medicine doctor or somebody else, you might get allergy testing as a recommendation. They're going to ask family history maybe, and they'll usually eliminate foods. And what I see is more than dairy. So maybe you have more people saying dairy. I hear a lot of dairy, gluten, corn. Corn's a big
Eggs,
one.
eggs is a big
Um,
one.
Soy sometimes, eggs is a big one that I see for eczema.
Mm.
And you're talking, like, I mean, if you're a breastfeeding mom or a mom of little children, that's a huge portion of a diet. It's in so many things.
Yeah.
So I think it's like heartbreaking to see these moms coming. They're at the end of their rope by the time they come to homeopathy.
Yeah.
So I think Melissa and I are really hoping, share this with your friends if they're not familiar with homeopathy. A lot of people don't know. They come when they've tried everything and their babies are suffering. They might cut foods and get a little better, but it doesn't take care of the problem. If they outgrow it, and I'm putting that in quotes if you're just listening, it's primarily either suppressed with steroids or other things, or sometimes antibiotics do show you see improvement, again in quotes, with
Mhm.
antibiotics,
Yeah.
but it shows up later, like I think you were going to say,
Yeah.
up
So,
later.
yeah. So if you use steroids, antibiotics, food elimination, garlic, essential oils,
Probiotics.
probiotics, all of those things can absolutely help. But if you don't uproot it with homeopathy, then later what we see, what Bree and I see in clinic is asthma, allergies, and behaviors. So please hear me when I say these things. I don't mean 100%. Of course, I'll say it again, like I always say, there's nothing that's 100% except for Jesus. Okay.
And we're
So
not over here like pretending that we've done years and years and years of data and research, but we have seen it often enough that we have had multiple discussions about this history that we're seeing.
yeah,
Also, I think there's a huge genetic component that I've seen too, that we've both seen, because their baby's born without any interventions, which means there is gut compromise
yep.
somewhere before this baby's born.
Mhm.
Typically, there's another sibling that has some type of skin issues. Cradle cap is an indicator. A lot of these babies have had cradle cap.
Yep.
Um, so it's somewhere. There is usually some history of asthma, allergies,
Mhm.
and eczema in the past or in siblings.
Yeah. And so not all babies that have eczema are going to end up with asthma, allergies, and these behaviors that we're actually going to talk about. The behaviors, what I'm talking about. And not all kids with asthma, allergies, and these behaviors had eczema as a baby, but this is just a common theme. This is a common thread that we're seeing, and really wanted to talk about it, just like you said, Bree, to encourage especially young moms to use homeopathy along with whatever else.
Mhm.
If you want to do probiotics and all the other things, do it. And also, what I saw as a lactation consultant, I'm still a lactation consultant, but I'm not actively practicing, right? So I'm not in the hospitals, seeing families every single day, and outpatient and inpatient. But what I saw while I was there in 10 years is I would be the one to tell the mom to do this food elimination, and they would come back for follow-up, and they're exhausted already. When they come in, they're already exhausted. But then I'm going to take away the pleasure of life, right? Like they're already
Oh,
there.
that's like,
Their
even
hormones are crazy.
convenience, hormones, yeah.
Yeah. Hormones are already crazy. Like if this is your first baby, you went from, probably a vibrant love life with your husband to now it's different. It's just different after you have your first baby. And, or, especially if it's early on, that's not there anyway. And then you've got, you can't have all these foods. You're tired. You're trying to breastfeed. Your nipples are falling off. I mean, and then here I'm going to say, now take all these things out of your diet. That is a
And then the
hard
mental
thing.
component of seeing your baby itchy, in pain,
Mhm.
uncomfortable, it looks terrible.
So
Moms
sad.
who have babies with eczema also get all the comments. Moms
Mhm.
do anyway, but when you have a baby that looks like that, sometimes people make a lot of assumptions. Sometimes, I mean, give a lot of unsolicited advice.
Yep.
And so you have that all on overdrive.
Yeah.
And you have to, a lot of times, heavily like prepare food. And granted, in an ideal world, we would all prepare really good, healthy food. But when you have to read labels, grocery shopping takes forever. You have to have the rest of your family has to eat like that, or you have to cook separate. It's
Oh, yeah.
layers,
Yeah.
layers of this.
Mhm.
I typically am like, listen, unless there's an active, obvious trigger,
Right.
or aside from like a true like anaphylactic allergy, I tell moms who come to me, if you've not already cut food out, use the remedies first. If we get to a point where that you need a little, or you could maybe help alleviate some of it by cutting out foods, but you might see a lot of progress without doing that. And often that's what happens.
Yeah.
I
Yeah.
actually don't know that I've ever had to have anybody cut out foods, with the exception of a couple who had severe actual like anaphylactic type allergies to things.
Yeah. I've got um I've got a few clients whose babies are under 2 and they had eczema as a baby and worked with me. We cleared up the eczema and then now they're showing signs of asthma, but that was there. So they had, and like this is within a few months, right? Because they're still under 2. So this is within a few months of each other. It's like the layer came off and now here's this next thing. Let's get it up too. Let's get it up and get it out too. Does that make sense? So I believe, I don't know which entity it is. The American Academy, the pediatrics, whoever they are. I think they call the eczema, allergy, asthma trio. Oh, what do they call it? Oh, they call it something. And so because they know that those 3 things go together and often, and what allopathy says is if the parents had it, then the kids are going to have it and all future generations are going to have it. So that's that miasmatic aspect. What are you seeing?
This is so interesting. I just literally Googled here, and I know you guys, I mean, most people who listen aren't going to be annoyed by that. So I'm looking to make sure this is a good source. But I'm seeing just at a first glance some of these AAP things or clinical studies showing that in general, infants with eczema are more likely to develop asthma than unaffected infants. About 30% of babies with eczema go on to develop asthma, and up to 80% of kids with eczema get hay fever or asthma
Yeah.
later in childhood.
Yeah. Yep. Yeah. So let's uproot it with homeopathy. So we talked about the allergies and the asthma that can come later, and that often does. And thank you for looking that up. The other thing that we see is behaviors. So ADHD like behaviors, the hyperactivity. I'm just going to look at my notes here and just look at some of the, there's a really common theme of behaviors that I see, especially in boys, but it is even in girls. And so ADHD, easily bored, impulsive, reckless behavior, physically restless, destructive, violent, defiant, low self-esteem. These children are very much worse to be told no, like you can't, and it's like a switch usually. I see these parents come and say, this is very different. This is not the child that I had the first 2 or 3 or 4 or 5 years. Something happened, and so then they start searching for what happened. Well, I want to say from a homeopathic standpoint, we don't have to know the etiology. We're just going to use the remedies that match the symptom picture, and it's going to work. It's going to help. So those are the kinds of behaviors. Can you think of any other behaviors that lots of fear, anxiety?
I think you covered, the ones I'm thinking of are all the ones you already said.
Yeah.
I think it's destructive or hyperactive, ADHD,
Yeah.
difficult behavior, things that should not be normal.
Yeah.
And those are more extreme. I did find the name of your thing, I think.
Okay.
The atopic triad.
I knew it was atopic, but then I second guessed
Yeah.
myself.
The progression typically begins with eczema, followed by food allergies, and then the development of asthma and allergic rhinitis, like hay fever. Doctors call this progression the atopic march. So these are from medical news articles that like research articles that I found, like published things. So not even just in the crunchy world that this is being seen.
Right.
Um, the difference is, or the interesting part is, even though that's a link, we still see so much suppression. There's very little, there's very little resources. There are very little resources available for really attacking the source of these things.
So,
Yeah.
so we've seen some really bad eczema cases, some really, and we talk to these moms personally, right? We talk to them on Zoom, we see their babies, we talk to them on the phone, we hear the despair in these moms' voices. And because you can imagine as a mom what it must feel like to see your baby really suffering like this. And sometimes, very often, parents will do anything, even if it's steroids or antibiotics, because they just can't, it's too much to bear. And so, and sometimes it's the mom that wants to hang in there, but the dad's like, absolutely not. We're not doing this. You need to go to the doctor. And then sometimes it's both parents. But what I want to encourage you with is that homeopathy works. Jump on it soon. So as soon as you see a patch, get in touch with us. And I just want to specifically tell you guys how good Bree has gotten at this. She's seen a lot of baby eczema cases. She's getting really good at it, and she knows the remedy. She knows and when I say baby eczema, you hear me. Eczema is eczema. It doesn't matter if we're talking about an older child or a teenager or an adult, male or female. But the time to jump on it is as soon as it pops up. So my daughter, eczema popped up on her face she's 17, just in the last 6 to 8 months. So that's kind of different. There's something happening in her immune system.
I have
Right.
seen it a few times in some adult clients of mine,
Mhm.
weirdly on their hands.
Yeah.
Most of the time I'm seeing it on hands.
Yes, I did that. I
Isn't
did
it
that.
weird?
That was, that was 5 to 8 years ago, I believe. And and it was really, so it was really worse on my ring finger and that finger. And and I worked at the hospital. So I had to wrap my finger because I had to do my
Wash it so much.
in and out. I had to do that between every patient. So I covered both fingers with Manuka Honey patches. So there would be a Manuka Honey, and it had the Tegaderm is what we called it in the hospital, but it's the clear bandage that is waterproof.
Mm-hmm.
So I would put that on in the morning around both fingers and then go all day long, and even washing, it would be fine. That was really just protection. That didn't heal it. Right. So homeopathy healed the thing, but also soap. So
That I was going to say that too. There are some topical things, hands especially, like really we've found any liquid soap irritates. People will say, I've tried everything natural, unscented.
all the clean soaps.
A couple, okay, we'll probably get there when we get into some protocols for a couple of the other suggestions we give. I did want to add 2 things before we get into protocols, or if you have anything else before then too. One is there is obviously a gut link here, which is why you see that progression to the eczema. Skin, period, is usually the first thing to present in most people. So especially babies, that's going to be one of your first things. And then it just gets deeper in the body, but it's a gut, which is why probiotics do help.
Mhm.
Less foods that cause inflammation does help. And so don't think those are bad things. What we're saying is just do it in tandem, or you might not have to do them.
Right.
So it could save you some of that work. And then also, if you're a parent who has already gone through the like antibiotics, lots of steroids, topical steroids, just know, I hope you know, or if you're just listening to us for the first time, no judgment at all. I have seen these babies at a point where moms are like, I just need some relief fast.
Yeah.
Of course.
Mhm.
So it can still, homeopathy will still work. Don't be discouraged or think you're ever too far gone.
Yeah.
It can still work. So just so you
Yeah.
know.
Exactly. Yeah. No judgment. And, I just want to encourage you not to carry guilt or shame over your past choices. We, as moms and parents, do the very best that we can do with the information that we have right now. That's all we can do.
Yeah.
When my oldest was little, and I fully believed that going to the doctor, getting all the vaccines, getting all the antibiotics, doing all of those things that the doctor told me to do, I believed that that was the very best I could do for him. And then it led us, through some pretty bad gut health issues, which led us to homeopathy. But please don't carry guilt or shame. So just backing up a little bit to the liquid soap, I just want to make sure you women hear that. It's the liquid soap. It doesn't matter how clean your soap is. It doesn't matter how unscented and how pure your soap. It doesn't matter if you make it at home. And I don't know why. It's the liquid soap. So I use a Bronner's baby something, the baby one, the blue, it comes in the blue, Dr. Bronner's.
Yeah. It says like sensitive,
The bar
no
soap.
unscented. Yeah. Oh, the bar soap.
Yeah,
Yes.
bar
Okay.
soap. That's what I use. And so a lot of people think that's really gross to wash your hands with bar soap. It is in my kitchen. I'm the only one that uses it. But how did we live all those hundreds of years with just bar soap?
Well, I also have seen people switch to like goat milk soap,
Mhm. Yeah.
and that works really well. I don't know what's in Dr. Bronner's. I like Dr. Bronner's too.
Mhm.
Um, but I'm not really a person who cares that much about washing my hands unless I have like raw meat on them or
Mhm.
a lot of diapers or something.
Mhm.
But I know it can be inconvenient, but I have seen that be really huge in people's healing alongside the remedies. One lady even like started bringing it to work with her soap because she washes her hands a lot at work. She started bringing her own soap
Yep. I
and
did.
just like do what you got to do.
Yeah. Yeah.
So
I love that you just said that you're not too worried about washing your hands, because I'm not either. I mean, really, like, unless I have something serious on them,
eh,
there's not a lot of,
I don't
no.
know. I know a lot of people probably think that's gross, but I
Right.
have a decent immune system, I'd like to think.
Right.
So
Exactly.
two little
Exactly.
bacteria, I'm like, man, you got to have a little bit in there.
You know
Anyway,
what I always think when I go, like, if for some reason I need to wash my hands, then sometimes I'll think, I'll just have this picture remembering, Jesus and all of them, they just like stuck their hands in a bowl of water. If they did that right,
yeah.
they all just
Look
went and
how they
like,
shared that whole bowl of water just sitting in the filth. Yep.
okay, so back to eczema.
I have another suggestion that I will throw in here for whoever's listening.
Yeah.
You had mentioned it, made me think of it. Manuka honey is one of the best topical things for, I mean, I've never had an adult use it on their hands. That's so smart.
Mhm.
But for babies, that or vitamin E oil. I will
Oh,
say be
yeah.
careful about where you source the vitamin E oil. Look at where they get it because some is from soybeans, some is from other things. So if you know your child reacts to certain food, don't get it from those sources. But Manuka honey, it creates a barrier.
Mhm.
So it is sticky,
Mhm.
but it prevents the itching and almost like it is very healing. It's antibacterial, it keeps it clean, and it does seal, it keeps it from itching. It keeps it moist without
Yeah.
a lot of the additives that other things have. So I've seen people love that and use it often.
Um, I love it. So since you brought that up, I am going to also mention here, I'm looking at my notes to see what the name of it is. There is, and I'm going to link this in the podcast notes. So in the not the comments, but in the description of this, whether you're watching on YouTube or look, under the podcast, there is a company. Why can I not find it? Well, there it is. Okay, so there's a company that I love that has eczema sleeves and eczema cream that I believe is again, it's beneficial. And I'll link the company. I'll put it in the show notes. I believe it's beneficial, but of course it's not going to uproot anything. I also really like organic shea butter.
Yes.
Raw organic shea butter is a great replacement for lotion.
Yes, it is.
So, shea butter can be so thick though. So if you've got very, if it's painful or super itchy, it might be worse. The friction might be worse, on that eczema, but there are some really creamier shea butters. So you can find a creamier one to rub on, but also shea butter kind of melts like coconut butter. So you could put some on and just let it
Yeah.
sit there for a couple minutes and then lightly spread it, you know.
Yeah.
Um,
And we
also,
do have you use some of these things because in the healing process, you can use some of those that are not suppressive
that's right.
because you're not going to see the quick recovery like you see pretend improvement, I should say,
Right.
with steroids. You put it on there and their skin clears up pretty quickly for a short amount of time. So homeopathy works slower, which means you might want a little bit of relief from the itching or the dry skin or something like that in the meantime.
Yeah. I also like Calc Phos 6X mixed with aloe vera gel used topically. You can do that. Yeah. Bree, I would like to, before we end, and I do want to give the Banerjee protocol for eczema, but before we do that, do you have a story or two of clients that you've seen? Because I really want, I just want people to know you're really getting to be an expert at this, and so I want to hear if you have a story or two.
I feel like this is one that I see really, and maybe this is why I love it so much. I see a lot of improvement in that first 8 weeks. So in children and kids or babies, it's much quicker. Adults with eczema, it still works, but it is slower. I think I see more of that spiral we've talked about where 2 steps forward, 1 step back. So with babies, they're also similar, but one, I remember just seeing pictures and this little baby on the video. I think it was extra sad because it was just on it, covered his cheeks. I'm pretty sure it started more on his trunk, and like thigh groin area. So it looked probably like more of the typical eczema that you see where it's the patches, the raised patches, as opposed to there is eczema that presents in the cracks first, and I'll maybe do that one next. So this little baby's face, it looked really sore and painful and would ooze a little bit. And then he would scratch until it bled, like just scratch and rip open those sores as his body was healing. So at his first follow-up, I can't remember what exactly so that's something we're going to talk about, but we sometimes do protocols. There are times where I'll do a protocol in tandem with another remedy, or honestly, often I would say it's 50-50 where I'm choosing a specific remedy for the case that is more fitting. His first follow-up, tremendous improvement. So a lot of times I'll see it move from the trunk to the arms or legs. And that it can be concerning, but to me, I mean, that is usually the progression of healing is it's moving out to the limbs. So his back and belly were almost totally clear. His diaper area was clear. He had a little bit of patches on the back of his legs and arms. His cheeks were still irritated because as scabs heal, they get itchy. So then we were kind of brainstorming, is this the eczema? The rest of his body looked so much better just in that first 8 weeks. So we were thinking of maybe the scabs are also getting itchy as they heal. And that's where the Manuka Honey was amazing for this baby. So she used those eczema little sleeves over his hands when he, at night he was a little baby. So he would just claw and Manuka Honey on his face. At the second follow-up, I mean, the rest of his body, she said that you could hardly tell this baby ever had eczema on his body. His cheeks were, I would say, 80% healed. So it really was that itching. We added a remedy for itching and then the Manuka Honey topically. And I mean, and that was within 2 follow-ups.
So cool.
So the
That's like
other
16
one,
weeks.
yeah, go ahead.
So that's like 16 weeks.
Yeah.
Mhm.
I will
Awesome.
say what often happens is you see a good amount of progress and then maybe a day or 2 of a flare in there. And then the same thing, a 2 or 3 week progress, and then maybe a couple days where you notice little patches that show up. But by the time that a lot of people with an infant come back at 8 weeks or a toddler, there is such significant improvement.
Yeah.
And then there was the other type, and I want to share this one because it presents a little differently, like the cracks. I see those like at the earlobes, or they'll be on their hands, wrists, ankles, elbows, behind the knee. And it's eczema, usually really itchy, but just a totally different, I guess a totally different, what am I saying? The way it's showing up.
Presentation.
Presentation. Yes, thank you. So those I'll use typically a different remedy. And those can be really painful because they'll dry and crack and ooze. I feel like that one was really within the first 8 weeks. They were almost totally healed. He developed some on other parts of his body that weren't those cracks. So it kind of shifted and moved. And then we switched to remedies at that point. But I would say, and I don't tell all of my clients this because I don't want to give anybody this false hope. Homeopathy does take time. But I see tremendous improvement almost every single first consult or first follow-up within 8 weeks. By the second follow-up, it's just cleaning up.
Yeah.
And I rarely have people go beyond that with horrible eczema. So like
So
you
good.
said, that one little baby had other things come up, like we're pushing out.
Yeah.
But
Yeah, that's so good. And so the encouraging piece here is start early as soon as you see any patches or cracks. And no, we can't promise everybody that's going to be 16 weeks, but imagine 16 weeks of dealing with it, right? Working through it, doing the whatever, Manuka Honey, the eczema sleeves, the whatever you can do to help the baby be comfortable for 16 weeks versus steroids, antibiotics, destroy the gut even more than it already is. And
it
and then
always comes back.
more. Yeah, it
It
always
comes back.
always comes back. And then and that's what I see too. People, will come to me and say, here we are again. We're looking for something different this time. But then you've got the asthma and the allergies and the behaviors. You're looking at the next 10 years or more, maybe even 15 years of dealing with all the other things that come up as a result. And just treating baby eczema with homeopathy isn't going to promise you a perfect child, but you can eliminate a lot of these things that happen just from using homeopathy. So let me give you guys the Banerjee Protocol, and this is straight from the Banerjee Protocol book, written by the Banerjees. And so from the book, which the only reason I feel okay giving you this from the book is that you can find this for free online, and their clinics are free. So if you go to the Banerjee clinic online, you can find these protocols there too, and they'll help you. So you could always email them and they might help you online. So atopic dermatitis is what they call it, and it is on page 49. The first line protocol is Hepasulf 200C, 1 dose every alternate day. Arsenicum album 200C, 2 doses daily. This may be repeated with 2 or 3 doses every day in case of acute itching. Coffea cruda 200C to be given for relief at the time of too much itching, and particularly for sleep at night if itching prevents sleep. In case of acute infection with ulceration, they say to use Serinum 1 in liquid, 1 dose, should be repeated every 15 days. This often gives relief, followed by complete cure. along with this, Coffea cruda 200C, 1 dose every 1 hour as needed, may be used to stop excessive itching. So I read that verbatim. Well, pretty close. I said 1 M instead of 1000C. So I read that from the
Otherwise
Banerjee.
verbatim. I read it with you. So
So I read it from the Banerjee Protocol book, and you can buy this. Where would we have them buy this, Bree?
Taproots, hold on. Dr. Ullman's website has it. You can get it on Amazon.
You
You're an
can.
Amazon person, you can.
You can,
Dr.
yes.
Ullman's clinic does send the Banerjees money. So they get a portion. You know that when you buy from Amazon, who knows who's getting the money.
That's
So
true.
Dr. Ullman is ULLMAN, right? Yeah.
And
So
Bree,
they sell it.
you talked to him personal, well, to his office, yeah.
Yeah, and so there was that concern about the misprinted copies and that they're not real. And as far as they told me that was a misprinted copy in 2019. They stopped putting the hologram, my words today. They stopped putting the hologram because there were issues with pages sticking or certain things like that, she said, in the printing process. So mine, it does not have a hologram.
Right.
So it does not have that. And so she said this printed copy was in 2019. They're going to sell them till they're out of them. And so Dr. Ullman went through and compared the two and came up with a document of all the changes. If you want that, you can email me or Melissa. We have that document, or Dr. Ullman's office. They send that with each of their books that you order, is what she told me. So don't be concerned. I ordered mine off Amazon to see, and I still got the document from Dr. Ullman's office, and it is just fine. Most of the misprints are was printed incorrectly, or they're mostly minor. But yeah, so I would feel comfortable buying it off Amazon if that's easier. Dr. Ullman's, you can support what they're doing. So both of those are good options.
Awesome. Very good. So, so if you want to work with me or Bree for your baby eczema or any eczema, go to my website, melissacrenshaw.com, under make appointment, schedule your free 15-minute phone call. And when you go to schedule that, when you look at my schedule, as of the date of this recording, you'll see I can't get a free 15-minute phone call for, like 8 weeks or something. Don't worry about that. Go ahead and schedule it. And then after you schedule that, there's going to be a pop-up or or an email, one or the other, that's going to give you the option to fill out an intake form, not an intake, an appointment request form to bypass that free 15-minute phone call. So if you fill out the appointment request form, I'm going to get it immediately. I'm going to review it within a day or two. And then I'm going to email you the options to work with me or Bree so that you can get started much sooner. I think that's a point of confusion for some people. And I don't know how I don't know how much more clear to make it. But I think when people go and see, 2 months before a free 15-minute phone call, they stop short. And, and then don't do if you go ahead and schedule it, you'll get the option to do the acute.
And that's almost an expedited way, but it is important that we have people do that initial, either the phone call. Some people really want that or need that. But it also does help us. We want to make sure people do understand the expectation,
right.
What to expect and how it works, but then what kind of issues you're dealing with. And we I think I take some of them and Melissa sends some to me, and then you take some that are probably just what you are. I mean, what do you specialize in? Everything else.
You guys, when you get that email, you'll have a choice of consults, and I just include, you can just choose. You can choose if you want to work with Bree, you'll be able to see her sooner. If you want to work with me, my options are there. So really, I just give everybody, it's just your choice. Just choose whichever one of us you want.
There are a lot of options. So you'll have a lot of choices. So I hope that was encouraging.
Yeah, I hope so too. That please make homeopathy the major part, the main part of your care plan when you've got a child or a baby or person with eczema. And then, we talked about, this is just one last quick point. We talked about the inherited, the inherited gut
Mhm.
as part of a reason why baby could get eczema. I did a whole miasms class that's on my website. I'll link that in the show notes also. And I'll link the eczema company for the eczema sleeves and cream. And we'll just look forward to hearing from you. Share this with a young mama whose baby is suffering. Jump on it fast. Thank you for listening. Thank you for being here to talk through eczema with me, Bree. And we'll see you guys next time.